Hey, good morning. This is Doug Fields, CEO of Institute for HealthCare Consumerism. Welcome to HealthCare Consumerism Radio. I'm joined by my co-host, Ron Bachman. Morning, Ron.
Good morning. I'm excited. Another great program. A lot of good guests lined up.
We have a lot of varying expertise on this show today. So,
yeah.
And we got a beautiful weekend here in Atlanta, too.
We do. The sun's going to be out. It's 10 on the millimeter or whatever they have here. It's nice to have it. I'm ready for spring. Maybe it's the first touch of it.
Well, let's get started this morning because we're pretty excited about our first guest. And she's first of all, she's a friend of the Institute and member of our League of Leaders. Joined us this morning is Dr. Wendy Lynch. Good morning, Wendy.
Good morning. How are you?
I'm fantastic. Where are you this morning? In Colorado or Arizona?
I'm in Arizona.
There you go. Got some sunshine down there?
Actually, we're having a very rare rainy day.
Oh, are you really?
But what that means is we get a lot of wildflowers, so that's a good thing.
There you go. Well, to our guest today, Dr. Wendy Lynch is co-director of the Center for Consumer Choice in Healthcare, and she at the Altarum Institute really tracks where the consumers are in this whole change that they're going through as it relates to healthcare and being better consumers of healthcare and better consumers of health. But I think it's very interesting. Wendy also has some interesting perspectives on employers being better consumers of healthcare. And Wendy, I'd like you to talk to our audience about that this morning, please.
Yeah, it's an interesting parallel that has, I'm embarrassed to say, only occurred to me quite recently. And I've been working hard on the reasons for getting consumers involved as essentially the employee involved in their own health care. And started to notice that we have a whole nother layer of consumerism that we're missing. So why don't I describe it in terms of an actual process that consumers go through?
Okay.
When let's say you're heading in to get an opinion about a knee problem, the reason why we want consumers to be more involved is what I might refer to as the 3 I's. Who has the information, who has the incentive, and who has the influence. So you're going in to get your knee checked out, and the providers very often have much more information than we do. They have had the training, so they're more informed about what the options are and what you could do about it. Mm-hmm. What we also know is that the physician, the provider, has an incentive, and we may or may not know exactly how those incentives are built, but they are essentially being paid by their practice, not by you directly. So there may be an incentive just by virtue of what their training is. If you're seeing an orthopedic surgeon, for instance, versus a physical therapist, they have an incentive to use their skills. So they may be more inclined to recommend something, one solution versus another. Mm-hmm. Then lastly, they have the influence. They have more control over what you're allowed to get, what you might get recommended, whether you can see one group or another. So the reason we've been asking consumers to get involved is because if you know more, you have a better chance of at least seeing what's happening and asking questions so that you can get more transparency. So I think this is something that you and the two of you are very familiar with, and that's what your whole work is about in consumerism as well.
Right.
Well, when I started to think about the employer purchaser, I started realizing that there is a very similar situation in the 3 I's. So when a small employer, for example, goes to a broker or a health plan to get a new renewal on coverage, the health plan and the broker have all the information. And the incentive is such that the insurer would like to sell you more insurance, and the broker is paid by the insurer, not you.
Right.
And they also have all of the influence because they will bring you the options. So in the same way that we want consumers to be more informed and get involved in decisions, I think that we've missed opportunities to inform and empower, especially small employer purchasers, to get over those 3 I's and get a sense of what their options really are, and are they getting the best solution and essentially treatment option, if you want to put that in quotes, as they could.
So what should an employer be doing under that thought process that they're not doing today?
Well, I've started to believe that we need a different kind of assistance when we are purchasers. So, number one, let's make some conscious choices about how much risk we really want to take. Mm-hmm. I think that often a broker will come to you and say, here's 2 or 3 plans, but we don't have a conscious discussion about, can our business take on more risk so that we're paying the insurer a lower premium because we're going to assume more risk? And what does it mean when we change the design of different policies in terms of how much we pay and how much we can get our employees involved? So part of it's about being conscious, and part of it is about recognizing the kinds of people that you want to have around you when you're making those choices by knowing what their incentive really is.
Does this fit into the developing changes in broker compensation? A lot of brokers have been enjoying that commission paid by the insurance company, especially when it was a flat commission, and as premiums went up faster than the CPI, they got to raise themselves by getting a certain percentage of the plan. But more brokers seem to be moving into the consulting area so that they are being paid more by the employer and not getting paid by the insurance company. Is this sort of part of that thinking that maybe developed is why you're moving in this research area?
Some of it is that. I think most brokers still are paid to a certain degree by the insurer. It's maybe a flat fee now, mm-hmm. Which means that the incentive is to do more deals and not to work as hard on any one deal, mm-hmm. because you're not going to get more by doing more. Mm-hmm. So, and just so any broker listening to this doesn't think, no more than I think all providers are in it for the money and will do an inappropriate procedure because of the incentives underlying it. No, it's not that anyone's a bad person or is mistreating their client. It's that those are the underlying incentives. Mm-hmm. So there are some brokers, as you mentioned, that are very talented and really are trying to do the best for the employer, and they are moving into more of a consulting role. It's true.
So the next time around, say I'm a small employer and I've got a broker, and I want to shop my plan, or I want to review my plan next year. Out of your research or your thinking in this area as to how to create sort of a consumerism on the employer side, what should they be thinking about? What should they do differently? If they like their broker, they're usually close relationships. There's a trust that's been built up there. They're not likely to change their broker. So right. What do you suggest that they do in working with their broker, maybe on a different approach to a new plan design, a new insurer next year, a community? What should they be doing?
Well, there's a couple things they can do. One is get a sense of how their trusted broker responds to questions about how much risk they're taking and what the premium differences would be if they accepted very different levels of risk. Is the broker creative in the ways that they can structure how things work?
Explain that a little bit more, Wendy. When you say how much risk they can take on, today the risk would normally be a fully insured plan. I know what my risk is. I pay my premium. I get my coverage for the employees as is defined. Or I can go to a self-insured plan where I am taking on more risk, and then it's a matter of how much reinsurance I have to protect myself from that risk. So are you talking about that kind of a risk or a different kind of a risk?
Yes, I am talking about that level of risk. And but there's in-between possibilities there. Mm-hmm. So you can take on a partially fully insured or fully partially insured.
Right.
And so you can have creative levels where the employer takes on a higher level of a fully insured but covers the difference.
Right.
So on behalf of the employee. So there are some very creative ways to lower the premium and then accept the risk for people who land in between.
Now, can a small employer do that under health reform? Because small employers, especially with the essential health benefits design, can they still be as flexible as what you're talking about as we move into the future?
My understanding is yes.
Okay, good.
But again, you would want to make sure you have a broker that knows what the limits are of what you can and cannot do.
Mm-hmm.
So Wendy, go ahead, Wendy.
So it's thinking about risk, thinking about design, thinking about how you're positioning the co-payments on, or the shared amount that goes to the individual. What sorts of plans are you trying to encourage versus discourage to get them involved? Are you helping the employee become a better consumer? So there's a lot of ways to be a little more creative than what I've seen in the past.
Mm-hmm.
So is your broker open-minded about that? And if they aren't informed, are they open to having an independent person who is not paid by the insurer come and do an audit and review what's happening in your plan, so that the broker can be a part of a team and not the only representative who's providing you with those options?
Wendy, this is very interesting. So as more and more employers are looking to create better consumers of health and health care with their employee population and require, some cost shifting to take place, et cetera, they themselves need to look in the mirror, so to speak, and say, hey, we need to become better consumers of health care and health on behalf of our organization, because we pay the bills, just as we're looking to hand this responsibility to and empower our employees.
Yes, and there's a tremendous amount of padding in these plans from what I've seen. Yeah. So if we aren't looking at what our medical loss ratio is for our own population, then we need to be paying attention, because insurers will take on the risk, but they will also charge you a lot for that risk.
Very, very interesting. Wendy, this time always goes by way too fast, and we've got about a minute and a half left. Could you kind of give some clear takeaways to our audience? Because I think this is very, very interesting topic.
Sure. Please take a look at your plan. Be conscious about what you're doing. If your broker isn't being creative, think about an external independent audit that's paid by somebody else, so the incentives are aligned. And know that there is a minimum of $1,000 per employee per year that is likely hidden in your fees somewhere if you haven't taken a look. So there's huge opportunities here.
Wendy, thank you so much for joining us today and taking time out of your schedule. I hope you have a great weekend. And for our audience, you can find Wendy on our website in the League of Leaders area, and where you can connect with her directly. And stay tuned, and we'll be right back.